Welcome to this explainer. Today, we're diving into the incredibly fascinating, really harmonious interplay between our external environment and our internal skeletal health. We are going to break down the first principles of vitamin D and the parathyroid and see exactly how our bodies manage what is honestly one of the most critical balancing acts in human biology. It's kind of an amazing question, isn't it? Have you ever actually thought about how a simple ray of sunlight hitting your skin sets off this wild, complex, multi-organ relay race that ultimately ends in solid, structural bone? Well, to understand this, we have to look closely at a microscopic network of chemical messengers and cellular factories that are literally working around the clock inside of you.
Okay, let's dive into this. Here is our roadmap for today. 1. Vitamin D and the parathyroid. 2. The vitamin D assembly line. 3. Secondary hyperparathyroidism explained. 4. Rickets versus osteomalacia. And finally, 5. When macrophages go rogue.
Section 1. Vitamin D and the parathyroid, the skeletal foundation.
To kick things off, we really need to understand the first principles of the endocrine network regulating our calcium. To maintain optimal calcium levels in our blood, our body executes 4 primary biological actions. First up, there's increased bone resorption. Simply put, this is just a fancy way of saying the body borrows calcium from the bone bank when your blood levels drop. Second, we have increased intestinal calcium absorption, which is directly mediated by calcitriol. That's the active form of vitamin D. Third, to preserve what we already have, our kidneys jump in and reduce urinary calcium loss. And finally, this entire system promotes phosphate loss. This intricate, highly coordinated dance ensures that our calcium levels stay exactly where they need to be to keep our muscles twitching and our hearts beating.
Section 2. The vitamin D assembly line, the synthesis pathway.
Let's move to and see how this builds, because you can basically think of your body as a highly coordinated manufacturing plant spread across 3 different organs. Step 1 begins right at the skin, where sunlight acts as that initial spark, initiating synthesis. Those raw materials are then packed up and shipped to step 2, the liver, which synthesizes intermediate forms of the vitamin. And then finally, those intermediate forms are sent down the line to step 3, the kidneys, for the final conversion into active calcitriol. Now, this step-by-step process is absolutely vital to understand in clinical practice. For instance, if a patient has chronic liver disease, well, their factory is broken at step 2, right? So they require a very specific 25-hydroxy-vitamin D supplement. But if a patient has kidney disease, their factory is broken at step 3, which means they must be treated directly with the fully active calcitriol. And this brilliantly illustrates exactly where these signals land. Look at the PTH1R receptor, acting as a specialized docking station. It's heavily expressed in the kidneys and the bone. When parathyroid hormone, or PTH, binds to this receptor, it orchestrates those crucial calcium homeostasis functions we literally just talked about, telling the kidneys to hold onto calcium and signaling the bone to release it. It's just a beautifully elegant feedback loop. Section 3. Secondary hyperparathyroidism explained. A system breakdown. But what happens when this delicate system breaks down and the raw materials are missing? Well, when vitamin D is deficient, blood calcium drops. We call this state hypocalcemia. And in response, the parathyroid gland just goes into absolute overdrive. It starts overproducing parathyroid hormone in a really desperate attempt to pull more calcium into the blood. We call this secondary hyperparathyroidism. The causes of this synthetic breakdown are vast. It can happen simply due to a lack of sun exposure in older adults or during winter seasons. In fact, to put that into perspective, some studies show deficiency in as high as 57% of hospitalized patients. It's also driven by chronic kidney disease, gastrointestinal malabsorption issues like you'd see after a gastric bypass, severe liver disease, and even certain drugs like phenytoin and phenobarbital, which actively increase the catabolism, or the breakdown, of vitamin D. Section 4. Rickets versus Osteomalacia. Structural integrity. If these deficiencies go untreated for too long, our skeletal foundation literally gives way. So the crucial point is understanding how this failure manifests depending entirely on a patient's age. On one hand, we have osteomalacia. This is the decreased or defective mineralization of newly formed bone at sites of bone turnover. This happens in adults whose bones have already completely finished growing. But on the other hand, we have rickets. This is the defective mineralization of cartilage, specifically in the epiphyseal plates, which are the growth plates in children. So while the underlying failure of vitamin D is exactly the same, the physiological canvas it paints on results in 2 very distinct conditions. The physical toll this takes on the body is profound, emphasizing exactly why maintaining this endocrine pathway matters so much for just everyday mobility. Patients suffer from deep, aching bone pains and proximal muscle weakness. Their compromised skeletal structure makes them highly susceptible to fractures and, especially in the case of growing children with rickets, visible bone deformities. This is the heavy price paid when our internal calcium economy essentially collapses.
Section 5. When macrophages go rogue, a system hijacked.
So, we've seen what happens during a deficiency, but what if the system's feedback loops are hijacked entirely? This brings us to a fascinating, albeit super dangerous phenomenon: rogue macrophages. In granulomatous diseases such as sarcoidosis, the immune system's macrophages start acting like rogue agents, completely ignoring the body's normal regulatory rules. Triggered by an inflammatory protein called tumor necrosis factor, or TNF, these macrophages cause a massive increase in an enzyme called 1-alpha hydroxylase. And what does this do? Well, it forces the conversion of intermediate vitamin D into its highly active form at a completely unregulated, hyperactive rate. Now, what's really interesting about this slide is how it visually drives home that these rogue agents cause dangerous hypercalcemia. Look right there. Alongside vitamin D intoxication, sarcoidosis, and other granulomatous diseases are sitting right there as primary culprits, because these rogue macrophages are just churning out active vitamin D without any off switch whatsoever. The intestines absorb far too much calcium, flooding the bloodstream and creating a highly toxic state of hypercalcemia. We've traced the incredible journey of a sunbeam transforming into skeletal strength, and we've seen how easily that multi-organ assembly line can be totally derailed by failing organs, lack of sunlight, or rogue immune cells. And it really leaves us with a provocative thought. With our internal factories balanced constantly on a razor's edge between harmony and havoc, how resilient is your own endocrine system? Thank you so much for joining me on this explainer. I really hope this helped illuminate the brilliant, fragile biology working inside you every single day.